Our next guest says we should make wellness an easy and invisible part of everyday life. Today, Dr. Emanuel has been called one of America's leading doctors. He's an oncologist, professor, and helped to write the Affordable Care Act. His new book is Eat Your Ice Cream, 6 Simple Rules for a Long and Healthy Life. Scan that QR code on your screen to buy it right now. Dr. Emanuel joins us. Good morning. Good to see you.
Thank you for having me. It's a great honor.
Glad you're here.
So you talk about the idea that pleasure is not the enemy of health, right? That it's part of what makes healthy habits sustainable. So how did that crystallize into this title, Eat Your Ice Cream?
Well, ice cream is a great pleasure in life, and it's also healthy for you. It decreases your risk of getting diabetes. It's dairy, got some protein in it, and you can't have self-denial if you're going to pursue wellness for your life. You're going to have to do it for years and decades. And it can't just be punishment. It has to be something you can enjoy and make part of your everyday habits.
I love that.
One thing that you shouldn't enjoy, though, you say alcohol. You said alcohol is one of the most confusing, divisive issues of our time, and that time only goes in one direction. Also, I don't drink, but I was surprised to hear you say there are no health benefits for anybody over the age of 40 when it comes to alcohol. Because we used to hear a glass of wine a day.
It's good for the heart.
Good for the heart.
Mediterranean diet.
Yeah.
Right.
And to that you say?
Well, the research is that from a physical standpoint, it's really not too good for you. Does damage to the liver.
Yep.
There are 7 different kinds of cancers that are promoted, and the risk is increased from alcohol. It's not good for the brain in terms of cognitive function, and it disrupts sleep if you drink it too close to going to bed. So in general, from a physical standpoint. Now, it does lubricate social interactions. People often drink to talk to others and have a good time. So you have to balance the social benefits and the physical. There are some rules about drinking alcohol, though. No binge drinking, no drinking alone, no drinking to drown out your sorrows. You know, it's really a social activity.
But social is the most important thing of this book. We all know about diet, exercise, sleep. We all know blah, 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 blah. We got to do that. What you say is the most important thing are your friendships, your family. That is more important to your health than any of the things that we can do.
Yeah.
And I don't think most people stress that enough.
Right. It's an ancient wisdom that man is a social animal. We actually thrive in interacting with other people. We get a boost, not just psychologically, but actually physiologically. Your stress axis goes down when you interact. And it turns out, when you do the research, that people who have more friends, interact more often, actually have longer life, they're healthier, and they're happier. They have more fulfillment. It is the single most important thing you can do. Call your brothers, call your dear friend, call whomever, and spend time.
Let me ask you something, Doctor, about this confusing information that we've gotten lately on public health right now, whether it's a debate over Tylenol, vaccines, dietary guidelines that have been changed recently, also funding cuts to critical research. What are you hearing from your peers in the medical community about all of this and how it might affect us?
Well, the biggest problem is the confusion. All of these changes, you know, I get calls from very smart people, my daughters, who are like, what are we supposed to do about the vaccine? No, I mean, seriously, they can call a doctor who can tell them, but most people can't. And that confusion is a serious problem because people don't have a lot of time to spend on trying to figure out what's going on. And this torrent of, as you say, vaccines changing, Tylenol and all sorts of medication warnings, the food pyramid changing. Yeah, some of those are really good. I think generally the food stuff that RFK Jr. has put out, don't eat ultra-processed food, not so much sugar, not artificial.
There's good intention behind it.
It's good. Right? The bad stuff is eat beef and eat a lot of, beef tallow, not so good. Up your protein, not so good. But there are, that's the good side. The bad side is all this vaccine stuff he's going in the wrong direction. We're going to have a lot of people dying in this country, especially young children, because of his vaccine changes, like no hepatitis B. That gives you liver disease, liver failure. We went from 20,000 cases a year down to about 20 cases a year with that vaccine. So we really need that vaccine, but he has made it optional. It's a problem.
Stark warning.
Well, people need to read your book.
Yes.
If they want to live longer. Most of us live to 78.6. We can live longer.
So that book, of course, is Eat Your Ice Cream. It's available right now wherever you like to buy your book. Scan the QR code on your screen to buy it and learn more about making wellness an easy part of your everyday life. Dr. Emanuel, thank you very much. We appreciate
Thank you.
you. We'll be